Hello, everyone. Hi. I got my AirPods in. Hopefully everyone can hear me. If not, let me know. So I'm going to give us a quick overview of kind of what we do here in our clinic with functional medicine. So I have my little outline I'm going to try to stick to so I stay on topic. First, I wanted to tell you about us. We are a functional medicine clinic, and that encompasses a lot of wellness and hormone replacement therapy. So there's a lot of different kind of functional medicine providers. We, in particular, have one medical doctor, Dr. Leanne Scott, who's amazing. And then I'm a nurse practitioner. We have two other nurse practitioners, and we have a physician assistant. So all of us are considered mid-level providers. Same prescriptive authority, just a little bit different titles. So we all do very similar things. So what is functional medicine is a question we get asked all the time. And what we like to say is we get to the root of the problem. So when you're feeling bad, when you have a lot of symptoms, it's about fixing the function that's wrong. And for us, a big emphasis is hormones, because that's what happens a lot in us as we get older, even in younger patients. And then we focus on nutrient deficiencies, gut health, brain health, lifestyle habits. So nutrition is a big thing, sleep is a big thing. So we try to include all of that to get people a very well-rounded approach to their health. So it's a little bit about what we do and who we are. We are under the name Leanne Scott. And so what happens when we see a typical patient? When you first come in, we do a lot of blood work. As our existing patients know, it's a lot of blood, but it's because we want to cast a really wide net of what we're going to look for. We check full hormone panels for males and females, full thyroid panels, and we do a lot of general wellness things too, like blood counts, kidney liver function. A big emphasis we have is also on heart disease prevention, so we look at a lot of markers there. And then your main vitamins and minerals, we want to see what's going on. So that's a big part. We do specialize in treating thyroid diseases. We specialize in treating menopause, but we also specialize with treating polycystic ovarian syndrome, PMS, and then we can't forget the men. They need help too, even though they're a little less willing to admit it most of the time. So majority of our practice is females, but I think that more men would come if they knew, because we're all women. I think that they think we only see women sometimes, but we have plenty of male patients. We do the same kind of workup for them. Of course, the treatment looks a little bit different. And so in addition to those big hormonal areas, we offer testing for the gut. The gut is now considered the second brain. That's what it's called oftentimes. We know it's extremely important for your brain health, your immune system, weight management, energy, brain fog, all those things. So we offer a couple tests for gut health. One has to do with food. So like I was saying, we do focus a lot on nutrition. Our big emphasis is usually on real food. We don't believe in gimmicky diets. We believe in eating whole, nutritious food. We have a lot of resources for that. But what goes along with it is what foods might you be eating that are making you have bloating or inflammation, things that could contribute to you not feeling your best. So that test is called the ALCAT. It's a blood test, and they actually test hundreds of different foods, and it comes back as you're good, or maybe it's causing inflammation, and that gives some guidance on how you can change your diet. Then we also do gut testing. And that is actually specifically with stool testing. You do it yourself at home. It shows us the bacterial makeup in your gut. So what bacteria are there, which ones are good, which ones are bad, what's the balance. That can impact physical symptoms, things that we don't love talking about, constipation, bloating, gas. But bigger than that, like I was saying, the gut is the center of our immune system. It's our second brain. So we want that area to be extremely healthy so that we feel our best overall. So that test can be really beneficial to help us identify those areas. Then we recommend supplements, dietary changes, whatever we need to do to clean up the gut based on those results. And then we offer a third test called the 𝘈𝘗𝘮𝘊. This one is Dr. Scott's favorite, so I learned how to do it from her. One of the first things I did when I started working at the clinic, it will test the blood levels of certain nutrients and then also the metabolites of those things in the urine. It helps fill in the gap of how your body is actually using those nutrients. So what that means is it gives very specific recommendations for what supplements you need. What foods do you need to incorporate? Maybe if there's a lot of toxic exposure or lack of antioxidants, what's going on in your environment around you. So those are some of the really big areas we focus on. And then, like I said, overall wellness. How are you sleeping? How are you doing with exercise? The dreaded word, exercise. It doesn't matter how old you are. Doesn't matter how active you used to be. You have got to be exercising. So that's a really big one. So that's a little bit more in depth about what we do. I would say, like I mentioned, our average patient is adults. We don't see anyone under the age of 18, but once you reach years beyond that, you're perfectly welcome to come. I see a lot of our younger patients, and by that I mean 20s, 30s. Everyone else does as well, but because I'm more in that demographic, I typically can relate a little bit better. And then I would say the majority of our patients are menopausal. And that's what really leads a lot of women to come in to see us, is that change, because you just start to feel really off around that time. And so then that's around the same age a lot of men come. But as functional medicine is gaining more popularity, we're getting the word out there, we actually have a large population that comes just for wellness. Maybe they don't even feel that bad. They just want to optimize how they're feeling. So really the biggest reasons I would say symptom-wise people come to see us would be weight gain, lack of sleep, lack of energy, generally just feeling like they've been declining overall and can't figure out exactly why. And maybe you've seen your regular doctor and been told everything is normal. And that's when a lot of people will come to see us, because they know we do additional testing. And we don't just treat within the normal ranges that the lab says are normal. We want to treat to make you feel optimal, which is that word, that optimal, optimization. What do we mean by that? And what that means to us is we might look at your, let's say, B12 level. And the normal range for that is 200 to 1100. And you might be at 400 or 500, which is technically normal. But we know that for you to be functionally getting the most out of that B vitamin, it needs to be on that top quarter of the range at least. So we don't want to treat you to excess with anything that your body doesn't need. We want you to be in the optimal range for those specific nutrients. And so that was a pretty simple example, but same thing applies to hormones. So when you look at female hormones in particular, and what happens with menopause and aging and cycles, let's take a menopausal woman, for example. Estrogen and progesterone, after your ovaries are done making them, should be 0. And that is normal, right? But that's not going to make you feel your best. It's also not going to offer you the disease prevention benefits that we're after. So for estrogen and progesterone specifically, based on research, we have goals we shoot for. Progesterone of 0 is normal in a menopausal woman, but ideally we want to get it between 10 and 30 to help you feel your best and get these disease prevention benefits. So then for estrogen, 0 again is technically normal, but we want to treat it to be 75 to 100 if you can tolerate that, because that's going to get you a reduction in Alzheimer's risk, heart disease risk, really helps you feel better in terms of mood and energy and mental clarity. And all the hormones that we use here in our clinic are safe. We only treat with bioidentical hormones, and what that means is they are chemically exactly like your ovaries, what they were making. That's all we will give you back. So the risk of breast cancer, blood clotting, those scary things that were shown with hormones were done, those studies were done with synthetic hormones. Those are the bad ones. So we steer clear from that, and that's why we're comfortable saying we want to optimize your hormones, because we know we're not increasing your risk of disease, we're actually preventing disease. So we do treat a lot of thyroid patients, and it's a very similar thing there. Your levels look normal, possibly, but if you're borderline, maybe too low on your active hormones, or maybe you have the autoimmune thyroid condition Hashimoto's and you've never known that before, or you did and been told there's nothing you can do about it, we know there's ways with supplements, medication, lifestyle that we can actually optimize the levels of those hormones to make you feel your best. So what I mean by that is your TSH, for example, is the signal that goes from your brain to the thyroid gland. It's one of the first things we look at, and as it starts to get higher and higher, might not be abnormal, but it might be at the high end of what's considered normal, and your doctor will tell you it's okay. But when we see that, we dive deeper and look at your active hormones, the T3, its precursor T4. And if those are on the lower end, that means your production of thyroid hormone might be slowing down, which can lead to fatigue and brain fog and weight gain and all kinds of stuff. Things that just don't make you feel your best. So your regular physicians might say everything looks normal, and technically you're in range, but your body might be needing more for you to actually get the benefits from it, and that's where we step in. Not always medication is needed, but there's certain supplements and lifestyle changes that we can make to actually optimize those levels. So that's what we mean when we say optimal, and everything that we do is evidence-based. So we're never going to suggest something that we can't prove based on research is effective and safe. So I like to say we stay in our lane. We know what works. We know what's safe, and just like for myself, I wouldn't do anything that would harm myself. I would never do that for my patient. So we don't just guess, we do a lot of testing. Then we are constantly doing continuing education to stay up to date on what are the best guidelines for treating thyroid, testosterone, estrogen, progesterone, and excuse me. And so everything that we do, we can back up. We're very confident with that. We also use a lot of supplements because most of us have nutrient deficiencies to some extent. That can be from other medications, poor diet choices, lifestyle stressors, but a lot of it unfortunately has to do with food now. It's not as nutritious. In a lecture last night, we actually learned that magnesium in particular, there's about 25% now compared to the 1940s in the soil. And so most of our food absorbs nutrients from the soil. So our farming practices, our food processing has all altered the actual content of our food. So that's why I get asked a lot, if I'm eating healthy, why do I need supplements? That's one of the reasons. But additional medications and stressors, like I was saying, can also impact that. So we use a particular brand called 𝘰𝘱𝘕. They're wonderful. They're not ours. We just like them the most because they prove what's in their products, and they do work extremely well. So that's why our patients are usually on a mix of kind of traditional, what you'd think of prescriptions, plus supplements. Then we go down further with that extra testing, and we can really give you a well-rounded approach to your health. We don't have a dietitian right now, but like I said, we're very passionate about nutrition, so we do set you up with resources to learn how to eat better, what that looks like. And I think those were all the big things I was going to talk about. And we had a couple of questions that came in yesterday, so I will answer some of those. The first one is, does hormonal birth control negatively impact females in the long run for optimal hormone levels? My patients know that I am not a huge birth control fan. Not in the sense that I don't want pregnancy prevention, but the hormones in birth control pills specifically that you swallow are synthetic. They are the type that have been studied and shown to increase things like your C-reactive protein inflammatory marker, which increases your risk of inflammatory diseases. They keep your natural estrogen and progesterone levels at 0, which is how they work for birth control. So without your own production of those hormones, you get a lot more side effects and symptoms. You can even have vaginal dryness, hot flashes, almost like menopause, but also brain fog, weight gain. They are not great to be taken long term. Sometimes the benefit of them does outweigh the risk, and very reasonable to take it for short periods of time, but there's really no reason that a woman who doesn't have some significant issue they're taking it for should stay on it for years at a time. I also think we use it probably in people that are a little bit too young, and it stunts their hormonal development a little bit. So I'm not against it in all situations. I do think there are better forms of birth control that are safer long term, and especially when you get close to perimenopause and menopause, people should not be taking birth control pills because of the increased risk with things like breast cancer and blood clotting. So I'm not completely against them. I don't think that necessarily they cause long-term damage that I know of. I just think they make people feel not their best, and there's a lot of good alternatives out there that we could try instead. It really depends on your age. If you are being treated with something like testosterone if you're a male, or estrogen, progesterone, testosterone as a female, then until you're stable, I suggest every 3 months if we're treating you. That way we can optimize those levels, make sure there's no real side effects going on, and we can find the perfect balance for you. Once you're stable, we recommend every 6 months, just so we can continue to safely monitor those levels, but again, tweak if we need to make you feel your best. Same thing actually for our thyroid patients. I suggest that we do every 3 months until we're stable. Sometimes I even check them every month if we're having a hard time getting the medication dose correct. Now, if you're not on any hormones and you're just more interested in seeing how things are progressing, every 6 to 12 months I think would be fine if you're not having a lot of symptoms. I do have some patients that are younger, don't have a lot of issues, just want to make sure they're staying on top of their health, and I will actually just check their levels once per year. So it's really up to what you're being treated with and what kind of symptoms you're having, but usually yearly is enough, I think. And then, let's see, can women take testosterone? I love this question, and absolutely, women love testosterone. It is just as important in us as it is in men. We just don't need quite as much. So some of the benefits, I think most people initially would think of libido, which it does help with, but from a long-term health perspective, it's more about keeping your muscle tone, keeping your bones strong. It's more about helping regulate your cholesterol and your underlying metabolism and your weight. So it does have some fairly obvious benefits with energy and motivation and libido, but from our perspective, we really like it for the long-term disease prevention benefits. So yes, women can safely take testosterone. We just have to keep you in the right levels. And then, if you get all of your hormones balanced, can that help adjust your thyroid too? I really do think it can. So what I see a lot of times, if there's a, say, female hormone issue or even adrenal hormone issue, if we get those regulated, it takes some of that pressure off the thyroid. Because as we go through menopause and the ovaries shut down, those hormones are incredibly important for our metabolism, which the thyroid, that's its main job. So if your ovaries are not helping the body anymore, then the thyroid has to kind of pick up the slack, is how I would describe it. So your thyroid can start to get taxed when your other hormone levels shift, It doesn't have to be menopause. It could be polycystic ovarian syndrome. It could be stress. And as we get those things calmed down, adrenal function, ovarian function, testosterone levels in men, I have seen people's thyroid function improve a lot. So not everyone needs thyroid treatment with medication. You might need a more well-rounded approach just to make your thyroid happier. So that's a good question. My PCP says my thyroid is normal, but I have symptoms of low thyroid. What can I do? I would say get further testing of the thyroid, because typically primary care doctors will check 2 levels, a TSH and a T4, which gives you a very basic view of what your thyroid is doing. We check, I believe it's 6, if I can count correctly, levels for the thyroid. So we dive deeper. We look at TSH, T4, T3, something called reverse T3, and we check to see if you have the autoimmune condition Hashimoto's. So it could be that you have those suboptimal levels that you need managed, maybe with either supplementation or medication, but it could also be that autoimmune thyroid condition Hashimoto's. We catch that on quite a few patients. It is more common in women, and more common after some type of stressful event. So we dive deeper to see, is it really your thyroid? And what's interesting about the thyroid symptoms is they can mimic a lot of other issues, like ovarian dysfunction, B deficiency, vitamin D deficiency. So it's not always just the thyroid. That's why we do so many labs, because we want to be able to say definitively, these are all your problems, these are not. And so it's worth diving deeper with more labs on your thyroid is what I would say. Then, does stress compromise optimal hormone levels? That is a big one. And yes, of course it does. So as we are stressed, the body increases stress hormones. The biggest one we think of is definitely cortisol, but there's a lot of other things that happen. Inflammation goes up. Your blood sugar goes up. Your circadian rhythm hormones get released at the wrong time. Your body can't heal and repair. And over time, if you remain chronically stressed, that will disrupt your thyroid, your ovaries, long-term your adrenals, and those stress hormones actually decrease the absorption of key nutrients. So I know the answer is yes, and there's so much more to it, but stress is one of those big things that impacts all of us. I have a few patients that I love to use as an example where we could never get them feeling perfect. Their levels were always great, but there was just something off with them. All the additional testing was great, and then they retired, and then they felt amazing. And it turns out their job was causing them a lot more stress than they even realized. And that's a little bit of the problem with our American culture is we think if you're not always going, if you're not stressed, maybe you're doing something wrong, and I don't think that's true. I think there's a healthy balance to be found. So I've seen firsthand in some of my patients what stress can do to their bodies, and it's not good. So chronic stress definitely will compromise your other hormone levels. And then, Melinda's can you balance? Oh, yes. Okay, so can you balance your hormones before trying to get pregnant? I am living proof. I am 8 months pregnant and working here for 4 years before I got pregnant. I definitely had some balancing to do. My thyroid was a little bit off, not drastically. I didn't have to do any major treatment, but with the right supplements and with a little bit of medication. In my case, I inherited it from my mom, so thanks, Mom. I felt a lot better. And then I was actually on a little progesterone as well, which we use a lot for PMS and polycystic ovarian syndrome. And it's really good for mood and sleep as well. You can use it even when you're not menopausal. And we do quite a bit. So I did that for PMS type symptoms and to just help regulate my cycle a little bit more consistently. And so I speak for myself, but I also have quite a few patients my age where I do similar things. And there's a lot of data that shows when your thyroid is regulated, when your progesterone is optimal, It makes ovulation more predictable. It makes pregnancy a little bit easier. So it's not always that simple, but to answer your question in a pretty simple way, yeah, I would get them balanced before you try to get pregnant, because then maybe you'll have an easier time. So then, isn't hormones just testosterone and estrogen? I think I've mentioned quite a few other hormones, so I think that the answer is pretty obvious that no, it is not. It's all of them. The thyroid, the adrenals, the ovaries, those are the really big ones that we focus on. And I'm 48 and don't sleep more than 3 to 4 hours each night, and I'm miserable. I would be miserable as well. A lot of that is probably starting to be the shift in hormones in your ovarian function. Normal for perimenopause and menopause is between about 48 and 52. That's usually when your hormones start to decline pretty significantly, but it can happen as early as your early 40s. What happens first is your progesterone will start to decline, and that usually leads to, I don't love this term, but it's the best way to describe it, estrogen dominance, where estrogen stays a little bit higher because you're still making plenty of that, but your progesterone stays on the lower side. And that impacts your sleep cycle. It impacts irregularity with your periods. It impacts mood. So irritability, anxiety, a lot of that goes hand in hand with your progesterone starting to decline. That's why it's one of my very favorite hormones. And that's why I use it in all ages at different doses. So my guess is it's your hormones are starting to shift. Melatonin, magnesium, there are some great over-the-counter supplements that can help too. But the bigger issue if you're 40 is probably that progesterone level. And that's just my guess. And then my OB says all my levels look fine, but I still feel off. Low energy, dry skin, weight gain. That comes back to what we do with the optimization of things. Your numbers might look normal for where you are either in your cycle when they check them or for your age if you're in menopause. They can look normal but not be optimized in the sense of for a 28-day cycle, they go up and down, they ebb and they flow. So maybe that flow, that consistent release of hormones is getting thrown off for some reason. Or like the first example I gave, if you're postmenopausal and they're 0, that is technically normal, but you're missing out on all the benefits of adding those back in. So sometimes it's that we need to get the progesterone and estrogen back in a balance, and then sometimes it's that you don't have any, and we need to get those back too. So OBs, primary care doctors, they really do mean well. I've worked in that world. Dr. Scott has worked in that world. We all have here. The problem is we don't get a lot of time in those settings to dive deeper. And I don't think it's anyone's fault necessarily, except the insurance companies, because they say we have to see patients every 15 minutes. So I don't think that your OB would try to write you off on purpose. I think that what we do in these types of clinics, functional medicine, we just have a lot more time and resources to designate to figuring out what's really going on. And is it ever too late to try and optimize hormones? Definitely not. There's some safety things we always consider with estrogen when people are older, way past menopause. We can still do it. We just have to do it safely in the right form. And we're living longer than we ever have. And that means that a lot of us are more at risk of disease. We want to live our best. And so part of that is keeping your hormones balanced, keeping your nutritional status balanced, and it's never too late to do that. I tell my patients, we're living longer than ever. How do you want to feel that whole time? Do you want to feel your best? Then let's talk about hormones and supplements and everything. If you're not that concerned, you just want to live, then, maybe you don't try to do everything. But I find that people will ask me a lot in the beginning, how long do I need to stay on these hormones? And my question is, how long do you want to feel good? It's a little sarcastic, I know, but it is true. Because if you stop them, you do lose out on the benefits of them. And it is safe to take the right kind indefinitely. So that's why I would say it's never too late to start. And there's never an exact cutoff point unless something else in your life kind of supersedes that fact that you can take them. So Let me see. Any other questions? Okay. I think I answered all the ones I have. Melinda, any other ones? Okay. If you have any other questions, you can submit them. We got a few more minutes, but I answered all the stuff I had in front of me. And I can ramble. So I can ramble all day if you want me to, but I'm pretty sure no one wants that. So I'll give it just a second, make sure no other questions come in. But I hope y'all found that helpful. I just kind of went through some basic stuff about us and what we do. Some pretty basic questions too. But, I mean, we want to do this more in the future, and we would like to know exactly what you want to know. So please leave comments. You can send us direct messages. Melinda is awesome. She does our social media, so she will definitely make sure we put these away for later use. But we want you to know what you want to hear about. So let us know. Oh, good question. Okay, this one is, I should have addressed this a little bit more. Do hormones cause cancer? And the answer is it depends. The kind we use, no. Like I was saying, we use bioidentical forms. Only estrogen that your ovaries were making. Only progesterone your ovaries were making. Same for testosterone and thyroid. We never do anything synthetic. So the hormones that were used in the studies that showed an increased risk of cancer had a little bit of a chemical difference. They were a man-made form of progesterone called progestin, and the estrogen that was used is from pregnant mares, so pregnant horses. So it had some of the same hormone that we use, estradiol, but a lot of different ones too. So our body didn't respond well to those as women. It created these negative metabolites that caused issues with inflammation and clotting and a slight increased risk of breast cancer. So the simple answer is no, if you take the right kind. And if you've ever taken something like Premarin or Prem Pro, those are the synthetic forms, and we would love to talk to you about switching those. But those are the kinds that you don't need to stay on for very long, just because of that risk. So. All right. Well, leave us any other questions and leave us any other topics you'd like us to go over in the future. I hope you'll have a great weekend, and I hope you at least maybe learned something, hopefully. But again, I'm Elise. I don't even think I introduced myself, but I'm Elise Clark. I'm one of the nurse practitioners. And then again, we have Dr. Scott. We have Cam. She's our physician assistant. And then we have Debbie and Kim, who are other nurse practitioners. So give us a call if you want to be seen and if you want to be optimized, because that is the catchword of the day. All right, y'all have a great weekend.